Hello and welcome to Health Harmony, where we bring you essential information to keep you and your loved one healthy. Today, we are discussing a topic that might not be as well known as some other, but it's incredibly important: bladder cancer. Bladder cancer is the 10th most common cancer worldwide, affecting thousands of people each year. Early detection and awareness can make a significant difference in outcomes. So let's dive into understanding what bladder cancer is, its symptoms, risk factor, and the treatment option available. What is bladder cancer? Bladder cancer occurs when cells in the bladder, a hollow organ in your lower abdomen that store urine, start to grow uncontrollably. Most bladder cancer begin in the urothelial cells that line the inside of the bladder. These cells are also found in other parts of the urinary tracts, which means bladder cancer can develop elsewhere too. But it's most common in the bladder itself. There are three main types of bladder cancer. The most common is urothelial carcinoma, which account for about 90% of all cases. The other type includes squamous cell carcinoma and adenocarcinoma, which are much less common. Understanding the type of cancer is crucial as it determines the treatment approach. Symptoms of bladder cancer. Bladder cancer often presents with symptoms that might seem mild at first, which is why it's sometimes caught later than it should be. The most common early symptom is blood in the urine, medically known as hematuria. This might be visible to the naked eye where your urine appears bright red or rusty brown, or it might only be detectable under a microscope. Other symptoms include frequent urination, pain, or burning sensation during urination, and feeling the urge to urinate without being able to. In more advanced cases, you might experience lower back pain, particularly on one side, and swelling in the leg. If you notice any of these symptoms, it's important to consult your healthcare provider as soon as possible. Risk factor. Several risk factors increase the likelihood of developing bladder cancer. The most significant one is smoking. Tobacco smoke contains harmful chemicals that are absorbed into your bloodstream and filtered by your kidney into your urine. These chemicals can damage the lining of your bladder, increasing the risk of cancer. Other risk factors include exposure to certain industrial chemicals such as those used in dye manufacturing, rubber, leather, textile, and paint products. Age is another factor, which most cases occurring in people over the age of 55. Gender plays a role too. Men are about 3 to 4 times more likely to develop bladder cancer than women. Chronic bladder inflammation and a family history of bladder cancer are also notable risk factors. Diagnosis. Diagnosing bladder cancer typically begins with a urinalysis to check for blood or abnormal cell in the urine. If bladder cancer is suspected, your doctor may recommend a cystoscopy, where a thin lighted tube with a camera is inserted through the urethra to examine the bladder interior. Imaging tests such as a CT scan or MRI can provide detailed picture of the bladder and surrounding structures. If any suspicious area are found, a biopsy will be performed during the cystoscopy. This involves taking a small tissue sample to determine if cancer cells are present. Early diagnosis is a key as it can be greatly improve the effectiveness of treatment. Treatment options. Bladder cancer treatment depends on the stage and type of cancer as well as the patient overall health. Surgery is the most common treatment, especially for early stage cancer. The goal is to remove the tumor while preserving as much of the bladder as possible. In some cases, the entire bladder may need to be removed, a procedure known as cystectomy. Chemotherapy is often used either before surgery to shrink the tumor or after surgery to kill any remaining cancer cell. Radiation therapy is another option, particularly for those who can't undergo surgery. In recent years, immunotherapy has emerged as a promising treatment helping the body immune system to recognize and attack cancer cells. For advanced bladder cancer, clinical trials may offer access to new treatments that are still being tested. These treatments can provide additional hope for patients with difficult to treat cancer. While there is no granted way to prevent bladder cancer, there are the steps you can take to reduce your risk. The most important is to quit smoking if you have not already. Smoking is the leading cause of bladder cancer, and stopping can significantly lower your risk. It's also important to limit your exposure to harmful chemicals, particularly if you work in an industry where these are used. Drinking plenty of fluids, especially water, can help dilute toxic substances into your urine, potentially reducing the risk of bladder cancer. For those at high risk, regular screening can be life saving. If you are in a high risk group, talk to your doctor about the possibility of regular tests to detect bladder cancer early. Bladder cancer is a serious condition, but with awareness, early detection, and effective treatment, many people can and do recover. Remember, if you notice any symptoms like blood into your urine or frequent and painful urination, don't ignore them. Talk to your doctor. Thank you for watching this video on Health Harmony. I hope you found it informative. If you did, please like, share, and subscribe for more videos on important health topics. Together, we can spread awareness and make a difference. Stay healthy and see you in the next video.